Good afternoon, friends. So I am sorry first for missing out last week webinar since I was in Singapore and I had forgotten that we are 2.5 hours early there. So 6 would be 8:30 and I was out with kids and grandkids. So feeling very bad to go back home missing out dinner. So I had to cancel at the last minute. The second session of behavioral disorders in children, as I had said last time, that this is a dry topic because we don't deal with it. We don't want to think how to deal with it. Second part is still drier, and all this we only need when we suspect something. So I will be keeping this video on YouTube for permanently, and those of you who want a copy of this presentation will be shared with you. Today we are talking on two conditions: ADHD, attention deficit hyperactive disorder, which is not restricted only to children because it is so less diagnosed. Many times you may have an adult who still ADHD can be diagnosed and can be treated. Secondly, we are going to talk a bit on autism and autism spectrum disorder, which is becoming very, very common nowadays, more so because of nuclear families. You know, all the earlier advantages of joint families, which are not there now, and nuclear families, parents working, children only looked after by nannies and no one at home, could be one reason for this autism spectrum disorder. Then, most of the time, it is seen that the behavioral problems in children are largely due to parents. Because a child learns at home, the surrounding in the house is the first school that the child has. And that, if it is faulty, then it becomes very difficult for the child not to have a behavioral problem. Now, I'll give you an example. Today, I was talking to a patient of mine. The child is 2-year, 9-month-old. And this lady, I have been telling her from the age of 1 year of the child to wean off. But you know, she had this feeling that I should give as much as I can give. Today, she came with a very bad inflamed boil. And I asked her, have you stopped breastfeeding? Because I wanted to give her NSAIDs. No, I'm still giving. So I said, why don't you stop? Then she's saying, doctor, you should see my son. He cries and that crying makes us very worried. He bangs his head on the floor. He plucks his hair because that twice a day breastfeed he wants. So I was telling her that, see, gradually what is happening is the most important thing to give a child is the sense of discipline. That, okay, you are my child, I am your mother, and this is the father, and this is the discipline. We will tell you how to behave. Now you are being ruled by the child, no? The husband said, I keep telling her, but she doesn't listen. And now the situation has reached here that when they spoke to their pediatrician man heard all that. They said you need to see a child counselor to wean off the child. Or I told her to go to a gynec, take treatment properly, because I was to give her treatment to stop lactation. But then she was worried of the second pregnancy if she gets. But stop weaning. Sorry, wean the child of breast milk. So the story came that most of the problems of childhood behavioral problems are due to parental handling of the children. So let's look at ADHD. One of the most common neurodevelopmental disorders of childhood. We don't know it is a neurological or we don't know it is developmental, but it is a very common disorder, more so diagnosed in US, very commonly now in India also. But I have seen certain children with ADHD who were having a lot of challenges when they were in school, but their parents persisted with proper therapy and medication. Today, at least 3 children are doing masters in US and have got very good jobs. Usually first diagnosed in childhood and often lasts into adulthood. Many times it is diagnosed in adulthood also if it is missed out in the childhood. Children with ADHD may have trouble paying attention to whatever they are told to pay attention to, control impulsive behaviors, may act without thinking about what the result will be. This could be jumping from a height without realizing. The child ideally has enough intelligence to realize that he can fall, but standing at a 6-foot table and jump with other features, the child could be ADHD or children could be overly active. It's normal for most children to have trouble focusing on something. But odd behavior may happen at one time or the other. But most of the children will grow out of these problems or these behaviors with time and age. So as a good family physician, our job is to make sure that we know what should be the normal behavior of a child at a certain age and what should be the normal milestone. Half of our patients cannot afford to go to pediatricians. And those who go also, they only visit nowadays only for acute sickness or vaccines. They never go for a regular checkup whether milestones are being attained or not. And it's good that we learn that. Way back in 2000, I had started a well baby clinic in my dispensary. And when I was preparing that, I landed up creating a website called growingwell.com. I'll show you the link in the end. That is still available and it's one of the very good resources. That website had featured on Britannica.com, CNN.com and BBC.co.uk among top 3 websites of child health coming from India. The symptoms continue. If the child is ADHD, it does not go away with time, could be very severe and can cause difficulty at school or at home or with friends. Because today's children are not tolerant. They will not tolerate anybody's odd behavior. So what a child with ADHD might have? Daydream a lot. Not delusional, but dreaming a lot. Forget or lose things a lot. Fidget a lot. They cannot sit still. Always fidgeting. Talk too much. Overactive or talking too much. Make careless mistakes or take unnecessary risk. As I told you just now, that jumping from a height, a 6-year-old child should know what can happen. Have a hard time resisting temptation. One ADHD child was diagnosed because this mother complained to the doctor, not to me, another doctor. That is how I learned that they got diagnosed, to a pediatrician, that this child loves sweets. So when guests come and we serve sweets to them, this child will eat from the plate, and if the guest picks up a piece, before eating his own piece, he will run to the guest and snatch from his hand. And the pediatrician then recommended to a psychologist, and they diagnosed ADHD. Have trouble taking turns. So like if you are playing cricket, it is everybody's turn. No, they want to be first always. Have difficulty getting along with others. Interpersonal relationships are very poor. So for all of you who do Google search to learn, DSM-5 is the Bible of mental health. The full form is Diagnostic and Statistical Manual DSM of Mental Disorders, 5th edition, the 2013 update to the Diagnostic and Statistical Manual of Mental Disorders, the classification and diagnostic tool published by American Psychiatric Association. Any disease, any mental health that you want to know the true picture, should go to Google and put the name of that condition /DSM-5, and you will get absolutely gold as content. So what are the DSM-5 criteria? Next few slides, I am going to be kind of reading because there's not much to explain. Wherever I have some examples, I'll be sharing. Inattention. A child, growing child with age, learns to give attention when it is required by him or her. So 6 or more symptoms of inattention for children up to the age of 16 years, or 5 or more for adolescent age 17 and above, give you a diagnosis of ADHD. Symptoms of inattention have been present for at least 6 months and they are inappropriate for developmental level. So then you should know what is the ideal development level. So which are the symptoms of inattention? Often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or with other activities. At work also, because it can happen in adults also. Often has trouble holding attention or tasks or play activities. Often does not seem to listen when spoken to directly. Suspicion of autism comes when you speak to a child and child does not look into your eye. But here, the child is not listening only when you are speaking directly, child may be looking at you. Often does not follow through on instructions and fails to finish schoolwork, whatever chores given or duties in the workplace. Loses focus, gets easily sidetracked. Often has trouble organizing tasks and activities. Children of a certain age learn to organize, but this child does not. Often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time. Mental effort over a long period of time is another term for focus. They don't want to do that. Most children do homework over half an hour, 1 hour, 2 hour with focus. They cannot do that. Often loses things necessary for tasks and activities. School material, pencil, books, tools, wallets, keys, paperwork, eyeglasses, mobile phones. This I'm talking of all ages. So homework is to be done, and now open the bag and there is no pencil, no pen, no eraser. Often easily distracted. Often forgetful in daily activities. So there are 5 of these and 4 earlier one, 9 inattention observations, out of which 6 or 5 should be present. Then other than inattention, there is hyperactivity and impulsivity. 6 or more symptoms of hyperactivity, impulsivity for children up to the age of 16 years, or 5 or more for adolescents 17 years or older, and adults. Symptoms of hyperactivity, impulsivity have been present for at least 6 months to an year, extent that it is disruptive, it is affecting the child's life, it is affecting the family's life, and inappropriate for that person, child or adolescent, developmental level. Often fidgets with or taps hands or feet or squirms in seat, cannot sit still. Often leaves seat in situations when remaining seated is expected. Teacher is taking a class. Everybody is supposed to sit. Principal has come to the class, but this child will get up and wander around. Often runs about or climbs in situations where it is not appropriate. Adolescents or adults may be limited to feeling restless because they realize that I cannot run around now. It is very inappropriate, but they become restless. Like a person working in an office, when boss is talking, he will not run around and walk around. He'll be very restless in his seat. Other features, often unable to play or take part in leisure activities quietly. If people are playing cards, if people are playing Ludo or a game, this person can't be quiet. It's often on the go acting as if driven by a motor, impulsive and hyperactive. Often talks excessively. Often blurts out an answer before a question has been completed. This you see in many patients, in adults also. Of course, all of them are not ADHD. The minute you start asking to a diabetic, do you take sweets? Do you take, have you said? And then they'll say, no, 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 never. But they're not ADHD. They are just trying to preempt your question. Often has trouble waiting their turn. As in I said, taking turns, playing cricket, playing a game, they don't wait their turns. Often interrupts or intrudes on others. If people are talking, this person will interrupt the conversation, giving his or her own view. Or even in the games, if 4 people are playing a game and it is not his turn, he will still take his turn. In addition to these, inattention or hyperactive impulsiveness, the following condition must be met. Several inattentive or hyperactive impulsive symptoms were present before the age of 12 years. Several symptoms are present in 2 or more settings, such as at home, school, or work, with friends or relatives, or in other activities. There is clear evidence that the symptoms interfere with or reduce the quality, social, school, or work functioning. The symptoms are not better explained by another mental disorders. Children can have depression, children can have anxiety, children can have bipolar disorder, children can be schizoid. So these features of the child are not explained by other mental disorders. The symptoms do not happen only during the course of schizophrenia or another psychotic disorder. If the child is diagnosed as schizophrenia or psychotic disorder or an adult, these symptoms don't happen only in the acute phase of the disease. Based on the type of symptoms, three kinds of ADHD can occur. Combined presentation, enough symptoms of both inattention and hyperactivity, impulsivity were present for the past 6 months. Predominantly inattentive presentation, enough symptoms of inattention but not hyperactivity, impulsivity were present for the past 6 months, and predominantly hyperactive, impulsive presentation. If enough symptoms of hyperactivity, impulsivity but not inattention were present for past 6 months. So you need 6 months also. You can't jump to ADHD diagnosis with only 1 month of symptoms. ADHD in adults often lasts into adulthood in children, or it can be diagnosed in adulthood if it is not diagnosed in childhood. To diagnose ADHD in adults and adolescents aged 17 years or older, only 5 symptoms are needed instead of 6 needed for younger children. Symptoms might look different at older ages. For example, in adults, hyperactivity may appear as extreme restlessness or wearing out others with their activities. I had an adult patient, which now I think was ADHD. Of course, he was a schizophrenic also. He was not schizophrenic, sorry, he was a bipolar disorder. But he ran a business and he would start meetings at 8 or 9 in the morning and go on till 6 without even lunch break or tea break. And anybody who had to go to washroom, he would look very angrily. This is about ADHD. I'm not talking of treatment because I do not ever want us to completely diagnose and treat ADHD. We have to refer to the right person. Then comes autism spectrum disorder or ASD. To meet diagnostic criteria of ASD according to DSM-5, a child must have persistent deficit. Persistent is lasting, not recoverable in short term. In each of 3 areas of social communication and interaction, plus at least 2 of the 4 types of restricted repetitive behaviors. So again, we have persistent deficit in social communication. Social communication, one is vision. You look into each other's eyes. Second is smile or talk. And third could be looking at you and talking. Let's look at them. Persistent deficits in social communication and social interaction across multiple contexts as manifested by the following, either currently or in past. Deficit in social emotional reciprocity. You smile at a child, the child looks away. A child of 2-year, 3-year can smile back and should smile back. Ranging, for example, from abnormal social approach and failure of normal back and forth conversation to reduce sharing of interest, emotions, or affect, to failure to initiate or respond to social interactions. Today, when you extend your hand to a child of 8 months or 1 year, very good chances the child will shake your hands. Deficits in developing, maintaining, and understanding relationships, ranging, for example, from difficulties adjusting behavior to suit various social contexts, difficulty in sharing imaginative play or in making friends, to absence of interest in peers. They go to school, they're not interested in others. Deficit in non-verbal communicative behavior like looking, eye contact, smiling. Poorly integrated verbal and non-verbal communication. Words and non-verbal do not match. To abnormalities in eye contact and body language or deficits in understanding. And use of gestures. They don't make any gestures. They don't point out to things. To a total lack of facial expressions and non-verbal communication. These children are like what in adulthood we say, no facial expression, suspect Parkinsonism. Deficits in non-verbal communicative behavior used for social interaction, ranging, for example, from poorly integrated verbal and non-verbal communication, abnormalities in eye contact. This is the commonest complaint. Patient will come to you, parents will come to you that no eye contact and child does not emote, no body language. Deficits in understanding and use of gestures, to total lack of facial expression and non-verbal communication. You know, when we talk, 33% are words, 67% are non-verbal communication. Severity is based on social communication impairment and restricted repetitive patterns of behavior. For either criteria, severity described in 3 levels. Level 3 requires very substantial support from parents and counselors. Level 2 requires substantial support and level 1 requires support. This is just the degree of support required on a child to adjust to normal surroundings. Then when we talk of restricted repetitive patterns of behavior, interest or activities as manifested by at least 2 of the following, either now or historically. Stereotype or repetitive motor movements, use of objects or speech, simple motor stereotypes, lining up toys or flipping objects, echolalia, idiosyncratic phrases. Insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or non-verbal behavior. Extreme distress at small changes. If a child is sleeping on a white bed sheet, you change it to light blue, the child will be distressed. If the nanny changes, the child will be too distressed. Very rigid thinking patterns, no greeting at all. And every time if they have to walk in the same pattern, the same line, and eat the same food every day. They don't want change. Highly restricted, fixated interests that are abnormal in intensity or focus. Strong attachment to or preoccupation with unusual objects. So this child has a blue blanket and will not leave that blue blanket throughout the awaking time. Even for sleep, she needs to be covered with that blue blanket only. And that blanket only, another blue blanket won't do. Excessively circumscribed, very focused or perseverative interest. They cannot change their focus of interest to something else. Hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of environment. Apparent indifference to pain, temperature, adverse response to specific sounds or textures, excessively smelling or touching objects. They may smell everything, even a spoon in hand to eat, they will keep smelling, or they'll keep touching everything. Visually fascinated with lights or movement. These children do not want mechanical toys, they want toys which are giving lights, emits light, or which they move. Symptoms must be present in the early developmental period early developmental is below 3 years of age, but may not become fully manifest until social demands exceed their limited capability, or may be masked by learned strategies later in life. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. Of current functioning means age-related functioning. These disturbances are not better explained by intellectual disability. A child may be dyslexic. A child may have another learning disorder or another developmental disorder. Autism spectrum disorder symptoms are not explained by that. Or if there is a global developmental delay, all milestones are delayed, autism spectrum is still a different thing. Intellectual disability and autism spectrum disorder frequently co-occur. To make comorbid diagnosis of autism spectrum disorder and intellectual disability, social communication, that means eye contact. Eye contact is the most important one that we can ask the parents, should be below that expected for general developmental level. Few guidelines for parents. Be a parent, not a pal. Because a friend cannot discipline. Being a parent means setting limits, making rules. All of us are today, even I am touching 70, I still remember the discipline my father inculcated in me. Discipline early, consistent authority and not vacillating. Now permissive, next time absolutely rigid. Today when parents come and tell me, doctor, he does not eat. 4-year-old child. I said, what do you mean? He only wants non-veg. Then I have to give them a talk on discipline. I said, everybody eats non-veg in the house? Only? No. This child wants everyday non-veg, each meal. You're not disciplined early. No, initially we gave because he had to put on weight. Spend time with your kids, not overplaying the quality time bit. This is a very common thing in today's parents who are both working. Doctor, we spend quality time on Sunday. A child needs a parent when the child needs him. Not wait a week for Sunday for that quality time. Child needs it then and not whenever. Don't get carried away with self-esteem. I want my child to develop esteem, so I will praise everything. Praise only genuine achievements. Not to protect too much when facing failure. Everybody has to learn to face failure. Today, parents, think that, oh, in my childhood, I didn't have all these luxuries. Let me give it to my child. No, that is beginning of the end. Control the electronics media, TV programs to be controlled and monitored by parents. And today you will see most parents, just because child should eat fast, give them mobile and let them see videos. Know what your child is up to. Unsupervised kids, more problems. Stay married. Children with only one biological parent are more likely to face problems. Unsupervised kids, more problem is one side. A child should be allowed to play freely. Nowadays, 6-year-old child, the parent has structured the whole day. 3 times a week abacus, 3 times a week swimming. Child has no time to do things that the child wants. Even that is wrong. Risk-taker kids are always in motion, pulling, pushing, and making a racket. These toddlers are at risk of developing aggressive antisocial behavior. A 6-year-old child went to a birthday party and friends rubbed cake on his face. Would you believe this child gave maa behan ka gali to the whole group there? And this child from childhood was always aggressive and parents never controlled. They were happy. Keep them from being overwhelmed. Gentle but firm challenges can help them learn to be assertive and confident by the age of 2. But gentle challenges. Underreactive kids tend to show little interest in the outside world. They rarely complain, so parents pay more attention to fussier siblings. They are ignored, and this gives a lifelong stigma to the child. Stubborn, defiant kids are trying to control their world. So parents should replace power struggle with negotiation. They have to be taught negotiation at an early age. Negotiation is give and take. It's not only give or only take. And hold firm on important issues like bedtime. A budding tyrant of childhood may become a great little debater, but may still have behavioral problems. So, bedtime, I will give you a good example of this. A very close friend, a single parent, lost his wife, 3 daughters. How to discipline? They were all 15 to 17, 18-year-old. So he said, you clear 10th. The youngest was 10th pass. You have to be home by 9 o'clock. 12th by 10 and graduate by 11. And after 9, you have to always remain in touch on phone. And the girls respected it. Today, they're all 40 plus and very responsible citizens. Father-child relationship. Father's role is not only to provide money. Father is supposed to be a vital factor in baby's development. Not many realize or accept this. They should find time to get involved in bringing up children and not merely to provide the funds and an occasional hug or pat or a gift. Child needs a role model, and who better than father? Of course, mothers can be wonderful role models, but today's societal things, father has to be involved, cannot be left everything on mother alone. This is my website called growingwell.com. This link, if you can photograph, or you can go to growingwell.com, it gives you all the information about milestones, about how the child behaves and how should the child be fed from 4 months onwards and everything. A mother must know about the behaviors, how the behaviors change, which commonly characterize each different age level, so that she can do a better job in dealing with the child. Problems she will face are not all unpredictable. They also follow a set pattern. At a certain age, child will give certain problems. The adolescent, if he is to grow up into a mature, capable adult, must learn to think and act for himself or herself, must grow beyond the places where he is completely guided by what mummy says. Again, we have a page of mother-child relationship. I would like to make 2 announcements here. Next 2 months, we will be having 4 sessions of experts, super specialists. We'll be circulating the program, but I will just share it with you right now. Thursday, 20th July, that is the next Thursday, update in pulmonology by Dr. Sonam Solanki. Dr. Aarti Mehta has been kind enough to introduce me to her. Then again, Thursday, 10th August, she will take on tuberculosis diagnosis challenges that we face. The webinar on 27th, I will be discussing 4 to 6 cases. Then 7th September, we have Dr. Sanjay Rajdev, a renowned cardiologist, talking on preventing cardiac complications in diabetes and hypertension. And then in October, we have managing chronic renal failure by family practitioners, because your patients of CRF, the nephrologist is not interested in seeing monthly. It's your job. So we will have 4 of these lectures over next 3 months. And one more thing, we are starting on those who are active on Telegram. We are starting a poll, a kind of a voting for people to elaborate on what their experience has been in practice. Again, Dr. Aarti Mehta has given a good quiz. Preeti will convert to a poll and put it tomorrow on Telegram. I request all of you to answer so that that will help others. And once it is over, we will publish the results and then everybody can then learn from them. Thank you very much. Dr. Aarti Mehta has commented on my breastfeeding case. She may have continued breastfeeding as a means of contraception and now got into vicious cycle. No, Dr. Aarti, I don't mind sharing here, all doctors. The husband for last 2 years, 9 months is facing total abstinence, because she has read somewhere that even lactation amenorrhea, you can get pregnant. So there has been no sexual activity at all. So this child, maybe her parents gave her some behavioral issue. Now she is giving to her children. So friends, see you next week. Thank you very much.